Hey everybody, Judy Seeger here, back, your host with the Ozone Therapy Summit. Thank you so much for watching. We know that you're getting a lot of great information from all our expert speakers. And in this interview, it's absolutely no exception. We have one of the top-notch experts in the world of ozone therapy, Dr. Rowen. Thank you so much for being on here today.
It's an honor to be with you. Thank you.
Yeah, and Dr. Rowen, I chatted with you earlier about how long you've been in this, and you had mentioned that you have been in this since 1986, the longest running practitioner in North America. That's fantastic. So truly is a privilege that we get to hear you and your expertise about ozone therapy, because we're really trying to get the word out about it and how it works. So let's start out with the basics, as we do with all the experts. First of all, what is ozone therapy?
Ozone therapy involves passing oxygen gas through a machine that puts out an electrical discharge and makes O2, which is what we breathe all around us, into O3, which is ozone. And only a small percentage of it gets converted to O3, maybe 2 to 5%. The rest of it is O2, oxygen. That gas then is collected by either the person doing it at home or the doctor and administered any number of ways to the body or externally. And it produces a whole slew of wonderful biochemical effects.
And so that's the technical term. And how does that work in the body?
Well, you know about what we did with Ebola. So I'm going to start with that, not for Ebola's sake, but how it works.
That's a great example, because Ebola, you were in the middle of that whole epidemic when it was really getting crazy across Africa, of course, and other countries. So you were part of that, helping to try to get rid of that and help people with that, yeah?
My colleague Howard Robbins and I took ozone to Sierra Leone, and the government shut us down for, I have no doubt, pharma reasons. This has been verified to me. But we did get to 5 patients. All 5 patients recovered immediately. That's unheard of with Ebola. So that should tell you, oh my God, this is a powerful therapy. So I use that as the example why. Not that we're going to have Ebola here in the States, though theoretically it could happen, but why does it work? Well, let's look at ozone's properties. When you treat somebody, first of all, ozone, when blood cells are exposed to ozone, their what's called rheological properties improve. Blood rheology is stickiness of cells, clumping together. It's their flexibility. For example, this is the size of a capillary. The red cell is bigger than the capillary, and it has to squeeze and compress and get through. If the red cell is rigid, it's going to have some trouble getting through, and it's going to stack up on the arterial end, and the capillary is going to be starving of red cells and oxygen delivery. So that's called blood rheology. It improves that. It also increases something in the red cell called 2,3-DGP. The red cell could be fully loaded with oxygen. It's the red cells that carry oxygen. It could be fully loaded, but it is unable to unload it. That requires a molecule called 2,3-DGP. And if it's missing, the red cell could go right through the capillary without releasing much oxygen. Ozone therapy increases 2,3-DGP to get more oxygen into the tissues. Based on Cuban research and European research, we see that after ozone therapy, the arterial oxygen goes up and the venous oxygen goes down. This larger difference, say from here to here, means more oxygen consumption in the tissues. It is oxygen consumption that we're after, because if you're burning oxygen, then you're making ATP energy. And ATP is what drives everything. We want to be burning oxygen. Just imagine you have a furnace. The more wood or coal you put into it, the more energy you get out of it. So the more oxygen we burn, the more energy we get. So those are three key things. The fourth is ozone modulates the immune system. That's good. Modulate means if the immune system is out of whack this way, it brings it this way. If it's out of whack this way, it brings it back into balance. So it improves the function of your immune system almost no matter what condition the immune system is in, including autoimmune disease or weak immune system. And the fourth thing is ozone is very harsh on microorganisms, both viruses and bacteria. But our cells are made for oxygen. We have outstanding oxygen or oxidation defenses, mammalian cells. So ozone is rather harmless to our cells. It's also rather harmless no matter what way you give it, except your lungs. Your lungs don't tolerate it.
Can you expound on that just for a second? Because I do get a lot of people hearing that it's dangerous for the lungs, and so then they stay away from it completely. And so can you just explain why it irritates the lungs?
It is. It's an irritant to the lungs, and it can be toxic to lungs. The lungs, for whatever reason, don't have great protection against oxidative stresses. And we know this because you could breathe oxygen, pure oxygen, 100%. And over time, you'll damage your lungs. So oxygen itself is toxic if you breathe it for a long period of time. This is just the way God made us. I can't explain why. But the lungs don't tolerate it. But otherwise, I have given ozone to virtually every part of the body that I could. I have given it by IM injection, joint injection, subcutaneous injection, ozone gas in the vein injection, intra-arterial ozone gas. I mentioned into joints, around discs. I don't go into discs. You need special equipment for that. I've gone vaginally, transvaginally towards the prostate. I don't have the equipment or the wherewithal to shoot it into the abdominal cavity because that raises risk. So I haven't done that. I've also done it into the cerebral spinal fluid. That's how safe this is. It's incredibly safe. So when it came to Ebola, just make a long story short, when you consider all those mechanisms of action and you considered how Ebola kills and how other organisms maim you, ozone was an ideal candidate because it improves circulation, it improves oxygen delivery, oxygen consumption, modulates the immune system so that if you have an immune system that's gone wild, like it does with Ebola, and you have lousy oxygenation, ozone therapy can dramatically improve it. And we showed that with our 5 cases. And that applies to virtually any infection that you're dealing with.
When you started as a medical doctor years ago, you were doing conventional medicine, but then somehow you found the ozone therapy. How did that happen? Because we, of course, want more. A lot of doctors will be watching this. I get a lot of people asking about my webinars. And I know they're going to be asking and saying, well, what is this ozone therapy that he's talking about? What made you change over or find ozone therapy to now really it's become a huge part of your practice?
It's a good bit of it. Well, first of all, for your doctors, I just want them to know that I teach ozone to worldwide audiences. We have quarterly sessions in our office teaching hands-on. But how did I get into this? That goes way back to medical school in 1974. At the end of my 3rd year, I almost quit. And I was a good student, good grades, no danger of failing, not making it. It was because in medical school, I was looking at the system and I was watching all these patients get run through pharma, testing, drugs, not getting any better, actually often getting worse and miserable. And I'm thinking, what am I doing here? I thought I was being trained to be a pimp for the pharmaceutical whores. And I almost quit, but I decided, look, I got 3 years into it, so I continued. I came to see that we were treating our patients as we treat the planet, poisoning it, poisoning our patients. So I just had an open mind to look for anything I could do not to give synthetic petrochemical pharmaceuticals to patients to cover up symptoms, because honestly, in medical school, I saw that's all we were doing. We weren't fixing people, except maybe for infection. You know, that's where medicine got the so-called silver bullet with penicillin. But otherwise, for everything else, from hypertension to vascular disease to autoimmune disease and cancer, we're just putting Band-Aids over them. So I kept my eyes open. Then I got into acupuncture in 1982, and that was my field until 1985, when I looked into chelation therapy for toxic metals and more, circulation. And then at a meeting in 1986, I came across an ozone machine. I said, ozone? This was 1986, when we were frightened to death of oxidants. The free radical theory was out there. So I said, ozone, an oxidant? And the distributor, the exhibitor at the meeting didn't really know what he had. He didn't. It wasn't his machine. He said, hey, I got some literature for you. You can look at it if you like. So I went back to my room and I couldn't put it down. I just stayed up till 2 a.m. reading the literature. And I was blown away by what I read from Germany. And I got up, I'm not a morning person. I got up 30 minutes early to get down to the exhibit hall to be the first in there to get that machine in the morning. And I got it. And that changed my professional life. From the very first patient we started treating with ozone and the results we got, it was like night and day in my medical world, my professional life. And for me, the patients come first, period. Not society, not the medical society, not the dogma. Getting my patients better comes first.
But back in 1986, by any chance, did they give you a hard time about using ozone therapy?
Actually, not at that time. I was in Alaska, which is a big land geographically, but small population. And I quickly became a known quantity amongst the population. So I was a big fish in a small pond. The medical community wasn't liking me, but the people did. And in 1990, we got North America's first law passed protecting alternative medicine. That was 1990. 2 years later, I was appointed to the state medical board. So this form of therapy, alternative therapy, was well protected in Alaska.
Wow, that's really interesting. I didn't know that. So, okay, now we talked about Ebola, and that's huge that you had 5 people, all 5 of them got their virus eradicated and they healed. Now, let's talk about some of the other conditions that you've worked with, Doc. I know you work with a lot of different things. Give us some examples of different things you've seen ozone work with and how the progress, because a lot of people want to know, okay, so if ozone comes in for their condition, how does that work through in the steps in their healing?
Let's take 3 different things. I consider, you asked me before, what do I specialize in? And if I'm going to use lay terms, pain from anything, including arthritis. So pain, immune dysfunction, circulation, and those are the keys. And cancer is involved in immune dysfunction. So what do we see? Well, I see autoimmune diseases. I have a guy who came to see me with dermatomyositis. He's on my YouTube channel. Seeing is believing. This guy looked like death when I first saw him. He was doing some work in our small orchard, and he was on 3 different very toxic immunosuppressive drugs. He looked like death. I immediately put him on ozone. I directed him to look for hidden infection in his teeth. He did this, and very, very quickly, he was virtually, I don't like to use the word cure, but his CK, which is an enzyme of muscle damage, peaked at 12,000, which is horrific, the worst I've ever seen. And within weeks after getting him on ozone therapy and fixing this, it fell to 300. And all of the symptoms are gone. I have patients with rheumatoid arthritis, similar. I'm not going to tell you they're in full remission. One, my key is she's had a really good life, and the disease is extraordinarily quiet, and she's totally functional. The disease is only limited to a couple joints in her hands, and she comes in periodically. We've seen other autoimmune conditions too like this. Remember, I said ozone modulates the immune system. And from my perspective, there's no such thing as autoimmune disease. I believe that the body is going after something and we don't know what it is. So I don't like the term autoimmune disease. Pain. I see a lot of arthritis. I see a lot of back pain. I see a lot of knee pain. Ozone is absolutely incredible at helping people with arthritis. And this is now being published in the medical literature. This isn't just me. Guys like me have known about it for 30 years. But now medicine itself is catching up. It's in the literature that you can really help low back pain with about an 80% improvement rate with ozone injected in and around the facet joints of the back. Knees, publications, and presentations, even at the American Rheumatological Society, that if you put the gas in the knee with degenerative joint disease, you can remit pain dramatically and quickly. And we save most of our knees from surgery or joint replacement. I'm not going to say all. The viewer has to understand there is no one-size-fits-all for anything. So if I tell you that we're doing really good for knees, it's probably 80–85%. And you can see these cases on my YouTube channel because I video them and I post them with their permission.
Yeah, and that's huge. Just wait a minute, Doc. And I know it depends on the person. I know it depends on the age and the level of damage that's happened. But when they come in initially for, let's say you mentioned the knee pain, and you work with them, how roughly, what's the time frame look like when they see noticeable improvement of their pain? Excellent question. My most viewed video was a woman who was crippled walking into the office, almost had to hold on to the walls, and she danced out of the office swinging her hips. And, and you have that on video? It's on video, and it's the first one, and it's the most popular, 36,000 views. One treatment. She had to come back 2 to 3 weeks later for a second treatment and hasn't had to come back since. Wow. And how old was she? About 60. Right. So that's huge. Now, let's just walk through some. That was a good case. Now, there's other cases that take longer. Sure, of course. Yeah. I'm doing a case now that's up to 6 or 10 treatments, and it's a slow progression. Sure. Just as long as the patient is progressing up. I don't care if it's like the last patient. Just as long as the patient's continuing to get better. But typically, I tell patients, give me at least 6 treatments before you draw any conclusions. But I'm impatient, and if I don't get a result in 2 to 3 sessions, then I add some additional things because it usually works that quick. Yeah, I'm like you. I want results from my people right away as well. I get more impatient than they do. So, Doc, when they come in, you had mentioned different applications. Typically, in your clinic, what's the way that you administer the ozone therapy? Well, if it's a joint condition, I go into the joint or around it. Injections? With an injection of gas, yes. And it doesn't hurt much because we've learned that we can use local anesthetics in conjunction with it. Ozone by itself, given the gas by itself, will sting the tissues for about 30 seconds, 30 to 60 seconds. I know because I've shot the gas in myself. But you can use a local anesthetic and reduce that considerably to completely. So that's gas administration to tissues and joints. Then you can give it in the blood. And we do a lot of that for Lyme disease. We have a large Lyme practice. And I think we get as good results as anybody. Maybe anybody in the world, I think. I don't know for sure.
I video these patients too, and they're posted, and they tell you their stories, some of them waking up from brain fog right in the chair the first session, others requiring 10 or 15 sessions, some doing poorly. And I have one 18-year-old kid who almost didn't start college because he was doing so poorly. He was from he's up on YouTube. His mother asked me for advice. I said, tell you what, send him up 2 weeks before he starts school. I'll treat him once a week and see if he can start school in 2 weeks. Well, he did. And he finished school with a B average. And he was very pleased. And the last time I videoed him, he said he was feeling normal and playing sports.
I saw that video. That was a great video because I had Lyme disease years ago, about 7 years ago now. And I did the sauna where you go in the sauna and then you have the ozone going. And
do that too.
First, as soon as I got out, I felt like $1,000,000. He's young, so he didn't see the difference. But me being older, I got out, I was like, wow, I feel like I'm in my 20s again. It feels great. And not that all my treatments felt that way, but initially that was a great feeling. So do you use the sauna as well, or is it just the injections that you use for application?
I believe that the intravenous, the IV method, and we do a therapy called hyperbaric ozone, which I think is the cat's meow of all ozone therapy, including.
Wait, so explain that. What is the hyperbaric of ozone? What is that?
In hyperbaric ozone, I'm going to use this as a glass cylinder, okay? It's a mug that's got water in it right now. So this would be hanging above the patient. There's a vacuum in it. Blood comes up into the bottle, and then ozone is administered to the bottle containing blood under pressure. And it gets a good mix, really, really good mix. And then the blood is returned to the body very quickly. I believe that this is the best method of ozone. A fellow named Lahadny, my mentor in higher doses of ozone from Austria, has pioneered high-dose ozone, and that has proven, in my opinion, the most effective form of therapy for Lyme disease and most of these other conditions. People respond very quickly. Major autohemotherapy, which is a lesser form of blood treatment, you just fill up a bag with blood and then add ozone to it and rock it back and forth and let it drip back in.
That's typically what they use here in the US, correct?
It is typical, and to me, at the level we've been doing it, it's almost like kindergarten. It works. It works. But nothing like this. That's major autohemotherapy. Now, if they have a good vein, I prefer that. If they don't have a good vein, or if they're needle shy, then we could put them in the sauna, or we could do an ozone colonic. We have a treatment that we have termed Colonox, where it's standard gravity water coming into the colon, and at the same time, a very large amount of ozone gas. Remember, this is oxygen ozone gas. It's not pure ozone. A very large amount of this gas enters the colon at the same time as the water. Ozone is soluble in water, so the water can carry it in, and the patient really gets a nice treatment with this. They get a colon irrigation, a colon detox, and a lot of ozone going in and oxygenating their liver and stimulating their immune system.
Wow. So that's, nobody else has talked about that. That's very interesting. And how long does that, yeah, that's really unique. And how long is that process?
That treatment is an hour. There's
okay,
only
so
two places.
That takes coffee enemas to another level. A lot of people with cancer, of course, do coffee enemas. Of course, Gerson treatment has put that on the map, which is great. But this is a whole different level. You're, like you just said, it's from kindergarten. Now we're taking them up higher. And initially, again, how do people feel after, for example, that the colon treatment?
Well, I will admit that's a little bit tougher on people. I'm going to use me as the example. It's both gas and water going in, so you can get some cramping. in your colon, and that can be uncomfortable for some people.
But a good coffee or a good colonic is the same, because I used to do that in my clinic, and they would get, if you're really good and you do some massage and do all that, they're going to get some cramping, which means they're alive, and that's a good thing, right?
That's exactly what's happening here. Yes, the patients like it. They feel better with it. Some do prefer that. Some do prefer the blood treatment. I usually, and some prefer the sauna. I really can't predict in advance, except that most people end up getting the blood treatment. But I tell them, if you don't feel like you got what we really want with the blood treatment, let's try the sauna, and then we could try the Colonox, and we see where that patient fits in.
So there's a lot of different ways that they could get it. That's not the issue. The issue is that they have to have something to go in there to, like you say, build up the immune system and get their whole system fighting against whatever it is they're fighting, whether it's pain, inflammation, or viral, whatever.
Inflammation. Let's talk about inflammation for a moment.
Yeah.
Arthritis is inflammation, whether it's degenerative joint disease or rheumatoid arthritis.
Right.
Pain is inflammation. Where there's inflammation, there's going to be pain, typically. Ozone modulates this. The Cubans have done research. It brings down inflammatory markers. It raises glutathione. It's paradoxical, but glutathione is the body's key antioxidant. And ozone therapy actually raises the three key antioxidants of the body: catalase, superoxide dismutase, and glutathione peroxidase. These are all antioxidant protective enzymes. And when you use ozone therapy, it's like pumping iron. How do you build muscle? You build muscle by pumping iron and exercising it. Ozone exercises these systems and makes those systems stronger.
And that's huge. That's an excellent, excellent example of how that really works. Now, I know and you know that ozone therapy, while we love it and know it's one of the most powerful therapies on planet Earth, we know that that's not the only therapy out there. We need to do things like detoxing and the right diet and all that, right? So let's talk about that, because you and I and all the experts actually on here, we all agree that there's different modalities you have to use with the ozone. So Doc, why don't you explain what modalities you have found to work really well in conjunction with the ozone therapy?
Well, my mantra for many years has been, I consider most all diseases coming from three sources: improper nutrition, toxins, and stress. Genetics plays a much less role unless you have an overt genetic disease like sickle cell anemia, Tay-Sachs disease. We've learned now that genetic function is modified by the environment, which includes toxins and nutrition. So I emphasize that I'm an organic raw food vegetarian. I'm not vegan. I eat dairy. I'm not 100% raw. In the summer, I am very close to 100%. This time of year, I do cook food. Not a lot, but I do cook. So I'm a vegetarian for spiritual reasons, so I can't compel my patients to be vegetarian. They can eat meat fine. But my mantra is move in the direction of more living foods, because that's what's on the planet. And I don't know any other animal in nature that's stupid enough to cook its food. Only humans do that. So more living foods, the better, so that the enzymes aren't destroyed. Organic, important. The fewer chemicals, the better. There's nothing that's organic anymore because we poison the planet beyond belief. But diet starts the process, eating right. The next part of the process is detoxing, getting toxins out of the body. It could be metals, it could be mercury from your teeth, it could be lead that's in the environment from all the industrial use. Our generation was exposed to lead. It could be chemicals. I mean, we've polluted this planet beyond belief. So I do whatever I can to help detox them, whether it's sauna sweats, whether it's ozone, because ozone is a fabulous detoxer. It oxidizes, which enables the toxins to leave the body. Might be getting metals out of the body. And I am not a shrink. I can't deal with their stress directly, but I'll try to help them identify it. And if I can help them identify it, then maybe I can point them in the right direction.
Yeah,
those are the basics. Getting exercise is important. sunlight is important. Meditating is important, or praying, wherever you're coming from.
Exactly. The challenge that I have found now, looking at the whole world, because you're one of the people that has traveled across the world teaching, working with different countries in ozone therapy, and I've gone around the world just once, but I'm finding that the need for the ozone therapy needs to really be across the world, but it's not, and people are getting a little frustrated in getting the therapy on, finding the docs and finding the way to do this. What do you recommend to help people across the world as far as getting to the ozone therapy? They can't all come to your clinic. We wish they can, right?
No, they can't. On our website, there's two ways to get to it. DocRowen.com, and the other way is drrowen, R-O-W-E-N, drsu, S-U, my wife.com. On our site, there's a list of doctors we have trained who want to be listed. These, I believe, are the best available because we have trained them in the best techniques. If there's not one in their area that's on our list, they could go online. Oxygen Healing Therapies has a site with a listing of doctors. There are several sites, but I believe that those we've trained are going to be the best. They're going to use the hyperbaric ozone technique.
Yeah, those are the sites that I recommend and I go to as well when I'm telling people. So I'm really glad you brought that up. Okay, just to finish up the end, because this is where people always get a little bit worried, is in your professional experience and all the years that you've been doing this, the thing that people are most concerned about as they're going through it is, first of all, does it really help them in their disease, and how safe is it, right? They're always worried about, is it really safe, and is it really for me? And, and I'm always trying to set some parameters for them. So let's kind of go through, whether it's cancer or Lyme's or pain, whatever it is, how do they determine that it's for them, and how do they know that it's safe for them?
Well, first of all, both my wife and I agree on this terminology for ozone. Ozone is the closest thing to a global panacea we have ever seen. The most important thing in healing is oxygen, period. Oxygen. Since my first treatment in 1986, and I saw unbelievable results, I've considered myself an oxygen doctor. You ask me what my specialty is? Oxygen. Because it is oxygen that is life. It is oxygen that provides energy. You can't do anything without energy. Is ozone dangerous? We've done tens of thousands of people, tens of thousands. And maybe I could say I might think of 2 people who might have an allergy and we didn't want to do it again. It's pretty good. If you give ozone directly in the vein, it can be hard on veins. My colleague Howard Robbins does DIV, ozone direct intravenous gas, cheap, extremely effective. The reason why I don't do it is because it can be hard on veins. And I would rather not lose a vein, so I would rather do a more expensive method of the blood treatment than putting the gas in. And it's not to make more money. Believe me, it's not. I would make more money doing DIV, but it is more expensive to do. It's extraordinarily safe. Some people will have a detox reaction. It's not common. I just talked to a woman a couple hours ago who did have it. She got bad Lyme and Bartonella, and she told me that she had a detox to a rather mild ozone treatment that we gave her. It's not common, but it happens. In terms of it being toxic, I would say if it's done right, it's essentially not toxic. It's not harmful. I don't see a reported injury in the world medical literature on ozone that's credible. That's credible. Anybody could report anything. For example, somebody tried to report that a patient who came in 12 hours after an ozone treatment with a heart attack, it was due to the ozone treatment 12 hours later. Not so. That was a major medical journal that published it, and they actually permitted rebuttals from 3 of us, including me, showing that the person had no business in publishing what he published. It was not consistent with anything he said. So if in 60 years, and probably now we're approaching 100 years of ozone use in the world, to find virtually nothing in the literature about ozone causing a problem, I would say that's really safe.
I mean, just look at 1 year of the statistics of what happens with the repercussions of people on prescription medication.
Aspirin. Aspirin's a good example. Nobody has a compunction about taking aspirin, yet we have thousands of deaths in this country each year from aspirin.
Right. That's just aspirin. Never mind all the other medication that is out there. And that's published. That is a proven fact. Versus ozone, you just don't see it. It's, yeah, the efficacy is incredible. So Doc, just to wrap it up and leave our viewers with this, you got into in 86, you've seen all this results. Can you give us something that stands out for you of somebody who saw a dramatic improvement where they said, you know what, I mean, not just pain, but like a disease state, where they had the treatment, they saw it, and they combined, because you had other modalities, the detox, the nutrition, all that. Give an example of somebody, because the biggest thing we always want to leave off is with hope. It's like, okay, you have cancer, you have all these diseases that you're worried about, but there's hope that when you combine this modality of ozone therapy with detox, nutrition, and everything else we're teaching, that it really can help people on many, many levels. But we're only going to ask you for one story. So if you have one to share with us, that would be great.
Right now, I have a cancer case I'll share with you. She's not that old. It's unknown why she got lung cancer because she wasn't a smoker, but she's got non-small cell cancer of the lung, and it metastasized to her back, and that's how they found it. It ate out a vertebrae in her back, and she's on my YouTube channel. And she came to us they had to put a cage in her back, a metal cage, to keep the spine from collapsing. And of course, I would want her to do that, but that doesn't mean that her cancer is gone. It just means that they are trying to keep her spine from collapsing. We started Ozone with her with some supplements, and I probably posted her a couple weeks ago to a couple months ago. Her tumor markers are down. She feels normal. She says, she basically can't believe it. She feels that good. Now, I'm not here to tell you that I treat cancer. I treat you.
Right.
I don't treat cancer. We want to try to detox you. We want to try and unleash your immune system to do what God designed it to do. So there you have a really good case. I've got another companion case of a man with prostate cancer where his numbers are now normal. And he's urinating normally. We injected his prostate. We did a number of other ozone treatments on him and nutritional treatments. The most popular video on my YouTube channel, as I mentioned, is a woman who came in crippled into the office. She got up from her chair, hanging onto the wall to walk to the door. And immediately after we did her treatment, she was swinging her hips and she couldn't believe it. And she's still good. Don't believe me. For the viewers who are looking at this, please don't believe me. And, you know, anecdotes, the medical profession says, don't believe anecdotes, it's garbage. I'm sorry, I disagree. When you have scores and scores, hundreds of people who are willing to put their face on the internet and tell you a story and say, and I ask them, do I have your permission to post this? Yes. That says something to me. That's, to me, this is to me, that's evidence-based medicine. Evidence-based medicine is what happens to your case, not what happens to the people over there. That's
exactly.
me.
Yeah, that's huge. Yeah, and I really appreciate that you made those videos. I saw quite a few of them actually before I got on this interview with you, and was just blown away how many people, like you say, were willing to share their story and tell the world what they felt, that they saw the difference. It's a shame that it took them so long, but they did it.
Let me give you another case. A man came to me from Oregon, 6-7 hour drive, and he had a catheter in his bladder because he couldn't urinate. Imagine what it would be like to walk around, especially you're a man, and you have a catheter hanging out of your apparatus. And we didn't know what we were going to get, but he allowed me to inject his prostate, which I did, and do some other treatments. And within a week or two, his catheter was out and he was urinating. And this is a guy who had total obstruction, needed the catheter, and his sex life improved too. That said, a few months later, he overused his bladder. He had to go, but he didn't, so he overstretched it. And he needed to cath himself once, and then he came back to me for another treatment, and I said, don't ever let that happen again. When you have to go, go.
Go.
And now it's been about 10 months, and he's not had an issue.
Right.
That's pretty good. Can you imagine? And he doesn't need surgery now to ream him out.
That's huge. Yeah. I mean, it's things like that that people need to hear. So I really appreciate you sharing that story. Well, we're out of time, Doc. Thank you so much for being on here. And we encourage all the viewers to get on your YouTube channel and look at all these stories. You literally have a ton of great stories of people who have used the ozone therapy and done very, very well. So for the viewers, we're going to have lots more experts coming up in the Ozone Therapy Summit. So glad to have you guys on here. Please watch this, share this, especially this one with Dr. Rowen, with your medical doctor. Share it out there. Let's get the word out. And those of you who have, of course, friends and family, share that as well. And love to hear from you. All right.
And I'm willing to train your medical doctor. Don't forget that.
Oh, there you go. There's the challenge, folks. There you go. Thank you so much, everybody. Appreciate you. We'll see you on the next video.